Hi, I'm Dr. Julie Steinauer. Today I want to talk to you about our topic for the month, which is nystagmus and how vision therapy can help. Now, before I go into discussing that with you, I do want to tell you how you can connect with us. If you're local, give us a call at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com. You've got two choices there. You can either click on the schedule a consultation directly with me, or you can fill out a questionnaire and get some feedback about your vision. Now let's talk about the 5 ways that vision therapy actually helps patients who have nystagmus. So if you're watching this video and you don't know what nystagmus is, it's a movement of the eye where the eye shifts back and forth. Sometimes that's side to side, sometimes it can be up and down, and it can even kind of have an oscillating or almost like a circular type of pattern as well. But for whoever is experiencing it, it can be quite a challenge to be able to feel like they're seeing clear and distinctly. Because the eye is in some sort of a constant motion, it's difficult for them to be able to stop and fixate and look at a target long enough to see it in clarity. Now, there are various levels of nystagmus, so obviously there are some patients who are able to see more distinct and some that have a really hard time seeing distinctly with either of their eyes. So nystagmus patients have a hard time stopping and fixating, they have a hard time seeing clearly, and they have a hard time with binocularity. So using the two eyes together as a team can be kind of challenging for them. So what are the 5 ways that vision therapy actually works with helping the patient who has nystagmus to do better visually? Well, number 1 is that utilizing Syntonics, which I'm just going to show you here. If you followed me for a while, you know I talk about Syntonics all the time, but this is a specific filter that we use in order to kind of help our patients who have what we would call brain injury. And you can see it's kind of a bluish purple. And in patients who have nystagmus, something has happened with the kind of electrical connections within the brain that's in charge of the movement of the eyes. And that's why the movement of the eyes is constant and they're never stopping. There's some sort of movement either again side to side, up and down, or like an oscillation that's occurring all the time. And so this first filter that I just showed you is one that we utilize in order to kind of slow down some of those oscillations or movements of the eye by just changing the way that the brain is electrically talking to itself and in talking in specific areas that are important for the ability of the eye to stop and fixate or focus. Now, what is another thing that we do? So we help them to stop and fixate, and secondly, focus, which is being able to see more clear and distinctly. So we use a filter in order to train the brain to be able to see more clearly. And that's this nice yellow. In fact, I can actually just kind of go like this and you can see that yellow there. But this one actually helps train the brain and the eyes to be able to see more distinctly. So it's really almost taking the patient who would be considered to be bilaterally or both eyes amblyopic because they're not able to see as well. And it's training the brain to have a better connection so eyesight can improve. So technically, I've kind of covered 3 things. One is to slow the eye movement down so that they can learn to stop and fixate better. 3 is to focus and see more clearly. And the 4th way that we help our patients through vision therapy is to improve their binocularity, or the 2 eyes being able to be used better together. Sometimes what happens is that in many nystagmus patients, they may actually have a component of strabismus or an eye turn. And so there are filters that we utilize. I can show you a couple of those also that can help train the brain to be able to control the alignment of the eyes. I'll show you one of those because many of our nystagmus patients will have some difficulty lining up their eyes. Let's see if we can do this. And you see it. if my pen works. There we go. It's kind of like a nice green, almost a bluey green kind of a color. So this filter would help to get the eyes to be in alignment laterally or horizontally. And then there are filters that we can use to train both halves of the brain to work better together, which helps for binocularity. It kind of looks like this. It's a nice purpley color. But what are some other filters that we also use for nystagmus? Oh, I have one more. Gosh, I can't forget this one. Okay, so this one helps to align the eyes vertically up and down, which could be important for our patients with nystagmus. Also, it's a nice kind of a royally blue color. And then I neglected to show you, so I've got to go back and show you a filter that's important. There's actually two that can help to slow down the movements of the eyes. And it's this one here. You can see how nice and greeny blue that one is. And then this one right here. So you can see that for nystagmus, which this one is a bluish purple color, you can see that there's actually quite a lot of different filters that we can use in order to slow down the movement of the eye, help the patient learn to stop and fixate, learn to focus, learn to align the eyes side to side, up and down, and gain better binocularity. And then there's also a fifth thing that we help our patients do with vision therapy, which is helping them to be able to establish stereopsis or depth perception if they don't have it already. And that's the ability of the two eyes to make a judgment of space and realizing how far away something is, making the world look like a three-dimensional kind of like popping out kind of a world. And if someone does not have the ability to see clear because they can't stop, fixate, and focus with their eyes due to the movement or the nystagmus, then helping them to achieve all of these other four things that we talked about will help us get to number 5, which is improvement on their stereopsis. Now again, there are multiple levels, there's multiple types of nystagmus. It can come from many different reasons. And we're not necessarily going into that video today because we really wanted to talk to you and focus with you on how we can help that patient with nystagmus through vision therapy. It is light therapy involved, so Syntonics or photo light therapy, and then secondarily it's coming alongside with various tools that we use to train our patients, again, how to be able to stop, fixate, focus, align and use two eyes together, gain depth perception, and see more clearly. So these are the 5 areas that we can improve with vision therapy. And if you'd like more information about how we can help you with your nystagmus, well then reach out to us. If you're local, call us at 618-288-1489. If you're not local, go to our website at visionforlifeworks.com, and you've got one of 2 options there. You can either schedule a consultation directly with me, skip all the steps and go straight to me, or you can fill out a questionnaire. It still is going to kind of bump you back around to, hey, do you want to schedule a time to meet with Dr. Steinauer? Now, if you like this video, hit the like button. If you haven't done so already, please subscribe to our channel. And as I always end our videos, if you know someone who has nystagmus and they could be helped by this video, please pass it along. You can help give them the gift of better vision. Thank you.